And I call Preet Kaur Gill.
Yeah. Thank you. Dame Maria, it is a pleasure to serve under your chairship. As the Minister has set out, we are here to discuss these regulations, updating legislation pertaining to in vitro diagnostic devices and to make supplementary provisions for the EU IVDs directive in Northern Ireland. This seems to be an innocuous SI to support the implementation of the new EU regulations that came into operation in Northern Ireland in May last year. These will continue to be applied as per the annex to the Windsor framework announced earlier this year, but with consequential amendments to other legislation, provisions for the fees for certificates and conformity assessments, and some practical provisions for the enforcement of the new regulations. It is, of course, critical that we continue to secure continuity of supply and trade of medical devices within the United Kingdom and with the EU. The regulations we are looking at affect a diverse range of equipment and systems to examine specimens in vitro, including things like blood grouping reagents, pregnancy test kits, and hepatitis B test kits. From catching killer diseases early to preventing infections, the medtech sector make a huge contribution to our NHS and our vibrant life sciences sector in the United Kingdom. These products can be found in doctor surgeries, hospitals, and our own homes, and we have seen during the pandemic how difficult it can be to replace them when their supply is disrupted. While the explanatory memorandum to this SI sets out that these regulations should only affect about 19 businesses in Northern Ireland and cost less than $5 million to implement, they are still a valued part of the UK medtech ecosystem. The opposition therefore support the regulations to secure unfettered access to the Great British market for Northern Ireland businesses and continuity of supply. Nonetheless, I would still like to pose a few questions to the Minister. We agree and welcome that the previous fee structure is being retained to reduce disruption to Northern Ireland operators. Nonetheless, can the Minister confirm what assessment has been made of any impact on the MHRA's responsibilities as regulator and that it will be resourced to fulfil them? Previously, government ministers have talked about future realignment of regulations for medical devices following our departure from the EU, including looking at alternative routes to the Great Britain market. Could he comment on the opportunities in this area and what is the timeline for the future regulatory regime that they want to bring into force? And the government has still not set out its proposals. Is there a timeline for doing so? It was interesting that medical devices did not receive attention in the Windsor deal. I know that some suppliers have noted disappointment at this, citing the complexity of navigating the current system. Is the Minister looking at the addition of other product classes like medical devices to its scope? Can the Minister also clarify the situation for devices where a conformity assessment has been performed by a UK notified body? Will devices bearing a CE conformity mark, as well as the UKNI mark, be able to be placed on the EU market? To my knowledge, no UK notified body has been appointed, so when will this be dealt with and what is the delay? To reiterate, we support the amendments to secure continuity of supply for the critical medtech sector. And I look forward to the Minister's response. Thank you.
Yeah. Thank you, Dame Maria. Can I thank